Good evening, everyone. Today we'll discuss the sickle cell case reports. First case is 23 years old, pregnant female. This patient is already a known case of sickle cell anemia. She is a primary gravid at 16 weeks of gestation with. She presented with pain all over her body and fever from past 3 days with breathlessness. The pain is there, fever is there, and breathlessness is there. There is history of similar complaint in the past. Receive occasional blood transfusion since childhood. It's 4 to 5 minutes. Received 2 units recently. On examination, vital was tachy was there and BP was 120 by 80. Respiratory tachypnea, tachycardia, SpO2 85% and room air. Mild icterus and spleen is 6 cm below the coastal margin. She already taking the drugs hydroxyurea from past 6 years. Recently stopped 4 months back because she is pregnant. So they have stopped. History of similar complaint in another sibling also. This is the case 3. This is the HPLC report. The other investigation like bilirubin. The total bilirubin is 3, and direct is 1 mg, and SGST is normal. Creatinine is 0.3. Urine, this is the normal LD, and she has a single eye ventricular. Spleen was 17 centimeters. You can see this is the peripheral smear. You can see the sickle cells. This is the normal cells. This is the sickling. This is the sickling. You can see these are the another sickle. These are the sickle cells. Multiple sickle cells in the peripheral smear. So basically the diagnosis is 16 weeks pregnancy with sickle cell in vaso-occlusive crisis with acute chest syndrome. So from this point you have to discuss this vaso-occlusive crisis and acute chest syndrome management. What is the treatment plan for the acute chest syndromes? Like management plan, the pain management, painkiller, you have to give tramadols and the paracetamol you can give. But you should avoid, very important statement, usually you should avoid NSAID, that is to 12 to 13 weeks if at all required. It can give, but usually you should avoid supplemental oxygen. Keep oxygen saturation is more than 95%. The target is more than 95%. The empirical antibiotics, that is subtraction, vancomycin, in some cases you can give, including atypical coverage. You can start like azithromycin. The spirometry has to be given to the patient, like 10 breath every 2 hours they has to do by latex balloons. LMWH prophylaxis should be started based on the body weight, like 1 mg kg subcutaneous once a day. And whenever you transfuse, very important, whenever you transfuse, you always transfuse the exchange transfusions. Judicious use of IV fluid to prevent pulmonary edema, 2 to 3 liters per meter along with soda bicarb, and folic acid, vitamin B12 supplement has to be given. So basically whenever patient came with sickle cell pain episodes, if you have to assess the pain, treat rapidly. Within 30 minutes of arrival, you have to treat the patient's pain management. You have to give opioid analgesia if you starting dose based on the patient prior pain and dosing requirement. Frequent reassessment has to be done, and dose escalation has to be done based on the pain. Suppose you are giving morphine, you have to pain assessment has to be done after 20 minutes. Suppose you have to give hydromorphine, then your pain assessment will do after 30 minutes. And pain assessment to top optimal assessment for volume status, hydrations with normal saline if needed. Then assessment for initiate treatment potential precipitating factor condition, like you have to always try to rule out, very important. These are the risk factors for sickle cell crisis. First, you have to rule out any source of infection. Second, you have to rule out the acute chest syndromes, because after pain crisis they will develop acute chest syndrome, strokes, and bone marrow suppression with reduced reticulocyte count, and hepatic or splenomegaly sequestrations, cardiomyopathies, feature of cardiomyopathy, organ injury or hemodynamic instability. In pregnant patient, assess, treat fetal distress, health syndrome, preeclampsia. So basically the therapies to be avoided in pain crisis, you have to remember, always try to avoid ice and cold compression, very important, because whenever you have a pain you always try to give cold compression ice. So you should avoid ice and cold compression because that will always precipitate sickling. Avoid mepridines, avoid ketorolac in adult, because ketorolac is given no more than 1 dose to be used. Anxiety you can use only if indicated for anxiety, not for pain. NSAID has to be used cautiously because they can cause renal failure and bleeding, may be ineffective in many cases. Oxygen support has to be given for hypoxia, not for routine pain. Use transfusion only indicated complication, not for uncomplicated vaso-occlusive pain. Okay.